Good morning, everyone. We have 12 new cases overnight. 6 of them linked to current exposure sites or identified close contacts, and the remaining 6 are under investigation. We're certain that 4 were in quarantine during their entire infectious period, which leaves the remaining 8 who are in the community for at least part of their infectious period. We have 13 people hospitalised, 4 in intensive care, and we now have 2 requiring ventilation. The new individual requiring ventilation in our intensive care unit is a man in his 20s with no pre-existing health conditions and who is not vaccinated. Yesterday there were 2,500 tests. This is just not high enough. The virus is out in our community, so it is critical, if you have symptoms, to get tested as soon as possible. ACT policing continue their active compliance across the territory, and yesterday conducted 110 traffic stops. And the good news is there was only 1 direction required to leave the ACT. So it seems the message is starting to get through. On vaccination, we are at about 68% of 16 plus with a first dose, and 44.5% of 16 plus fully vaccinated. Subtract a few percentage points from each of those figures for the 12 plus count. We have a milestone, an Australian first. ACT residents 75 to 79 years of age have become the first cohort in Australia to cross the 80% fully vaccinated target. So thank you to those Canberrans who have got vaccinated and become the first to cross that 80% threshold. Yesterday, 16,210 Canberrans aged between 16 and 29 booked their vaccination at an ACT government clinic. Bookings for a Pfizer vaccine for people in this age cohort are unlikely to be able to be administered until October, though. We desperately wish that we had more Pfizer vaccines, but we don't. If you don't get your first dose of Pfizer until October, then it's a further 3 weeks until you can get your second dose, and then a further 2 weeks until you are effectively vaccinated. This means for people in this age cohort, you're facing 2 to 3 months without vaccine protection. A single dose of vaccine protection does provide you with a much greater degree of protection than being unvaccinated. So to people in that age cohort, please be very careful with what you do over the next few months. Please don't take unnecessary risks. You are not vaccinated. You are the most prone now to contract the virus. This virus is going and circulating amongst the unvaccinated predominantly. The best vaccine you can get is the one you can get today. The AstraZeneca vaccine is available today from GPs and pharmacists. Now, looking ahead, what do the next 3 months hold for the ACT? We are facing a challenging scenario. There are no easy choices. Canberrans have worked incredibly hard to minimise the spread of the virus and to significantly reduce the risk to our community. We did it last year and we're doing it now. Our strategy is to get our caseload down as quickly as we can. What that means is that new cases are able to be linked and that they are in quarantine for their entire infectious period. Throughout the pandemic, stretching all the way back to when it started in March of last year, Canberra has been in a very good position. We've had low or no virus in our community. This has served us incredibly well for 18 months, and it is serving us well now. We should not be giving that up easily, and we won't be. What that means is the next few months, whilst we fully vaccinate hundreds of thousands of Canberrans, are going to be difficult. We have so many competing priorities that we have to balance over the coming months. Our number one priority is public health. We can only gradually ease restrictions as the vaccination rate increases. This means there will be inconveniences, there will be frustrations. We will try and minimise these as much as possible. But you can help in 3 ways. By getting vaccinated. And thank you to everyone who has come forward, those who have made bookings, and those who will get the AstraZeneca vaccine today. Thank you. We can and should lead the nation on vaccination. It's a worthy goal to strive for. The second thing you can do is to come forward for testing immediately if you have any symptoms. This is not a time to soldier on if you are unwell. Time for Codral perhaps to get a new advertising campaign. If you have symptoms, if you test positive, you must isolate and quarantine if you are required to do so. Every person who does that and who's not infectious in the community contributes to making the community safer for everyone else. And finally, we need to follow the public health directions. Stay away from other people as much as you possibly can. Wear a mask and wear it properly. These things will make a difference for all of us. The measures are put in place to protect you, to protect your family, and to protect our community. And if we continue to do this over the next few months, we can all look forward to much better days and a great Christmas with our family and friends. A Christmas where the gift we are bringing is not a dose of COVID, but an opportunity to come together as a community and to celebrate all that we will have achieved over the last 3 months. That's what we're working towards. So for those who've joined late, a summary again, 12 new cases, 6 of them linked, 6 under investigation, 8 infectious in the community for at least part of their infectious period, 13 people in hospital and 4 now in intensive care. I'll now hand to Dr. Johnston to provide some further details on new cases and the epidemiology of the outbreak. Minister Stephen Smith will then provide a health portfolio update and then we'll be available for questions. Thank you very much.
Good morning. I'm Dr. Vanessa Johnston, ACT Deputy Chief Health Officer. So, as the Chief Minister has just said, since our update yesterday, the ACT has recorded 12 new COVID-19 cases. Our total for this outbreak is now 309. The good news is that as a total of 51 of our cases have now fully recovered. So that's 10 more than yesterday, and that leaves us with 258 current active cases. Of the new cases today, I can confirm that out of 12, 6 can be linked to known cases. Of those 6, we know all of them are household contacts. Out of the 12, 4 were in quarantine for their entire infectious period. The remaining 8 were all infectious in the community for at least part of their infectious period. As of 8 p.m. last night, 13 people are in hospital. 4 of these are in ICU. 12 of these are unvaccinated, with one person having received 1 dose. Unfortunately, we now have 2 people requiring ventilation. One of these is aged in their 40s, and the new case we're reporting today is aged in their 20s. I can confirm they have no pre-existing medical conditions and are unvaccinated. Of the 13, the youngest is 18 years of age and the oldest is 54. Since our last update, we have just over 1,100 self-identified close contacts and over 4,200 casual contacts. We continue to have over 220 current exposure locations dispersed right across Canberra. There have been over 580 exposure locations since the outbreak began. Please continue to keep up to date with the current exposure locations on the website, and if you have been to an identified location, please follow the public health advice. That includes isolating and getting tested. So now we'll move on to some broader analysis of the outbreak. In terms of the age breakdown, 33% of our cases are in people aged 0 to 17 years, 51% are aged 18 to 44, 13% are aged 45 to 64, 3% are aged over 65. So we continue to have 12 sites of public transmission. Overnight, the following new cases have been linked to our existing public sites of transmission. So 3 new cases have been linked to the Bright Bees Early Learning Centre, and they are all household contacts. 1 new case is linked to Assembly, the People's Pub. We continue to see the total number of cases associated with each site change as our team continue to confirm and indeed at times reclassify links to each site. So I'm going to go through the numbers at each of those public exposure sites because I know that's of interest. So Bright Bees Early Learning Centre, 37, Ainslie Village, 3, CIT Reed, 5, Gold Creek School, 2, Downer Community Centre, 13, Fiction Nightclub, 51, Assembly the People's Pub, 7, Lennox Jaguar Land Rover Dealership, 20, Lynham High School, 50, Belconnen Basketball Stadium, 7, Southern Cross Basketball, 44, and the Murchie Indian Restaurant, 7. So yesterday I undertook to provide an update on the total cases in the disability cluster that we've been reporting on in recent weeks. So the total is currently 20. I believe this is up by 2 since we last spoke about this cluster. There's been no new cases into this cluster overnight. So we continue to work with those who are affected by this to provide them ongoing support. So while we're in lockdown, we're trying to minimise movement, of course, throughout the community. But I would like to take this opportunity to reiterate that if you feel like you're in any type of danger at any time or need access to health or social support services, then it is absolutely okay to leave your home to access these. This is not in breach of the public health directions. Many of your normal support services are open or are functioning via telephone and video appointments. For more information, you can visit the ACT Health website. We know that being in lockdown is really challenging and that people find it really hard not to be with their friends or family. We hope that being able to use your 2 hours of outdoor recreation time with your household or in a group of up to 5 people will allow you to reconnect with those who you miss and love. But please remember that this virus spreads quickly. We need to continue to be COVID safe, always wear a mask where possible and maintain social distancing wherever you can and when out of your home. So before I finish today, my shout out today is to the families and friends that are supporting our essential workers. This is often a thankless job, and a lot of these people are juggling working from home, caring for children or family, and attempting homeschooling, which I know many of you would appreciate is not easy. They continue to do this so that our essential workforce can work day and night to provide the vital care and support to our community during this difficult time. And because it is one of the many privileges I have to stand at this podium, I'm going to give a shout out to Tom and Isla in my family. Thank them for their love and support. Thank you.
Thanks, Vanessa. And I'm going to continue on at the start of my comments today, Vanessa's theme with my shout out, which today is to the children and young people of the ACT. And I particularly want to acknowledge how difficult lockdown can be for children and young people, particularly those who might be at home by themselves with no siblings, only children, who haven't really had the opportunity to hang out with playmates over the last few weeks of lockdown. So thank you very much for doing the right thing, for helping to keep the community safe. I hope the very slight easing from 5 p.m. today will mean that you're able to catch up with a couple of friends and again have that social contact that is so important. We have heard from children and their families that they've been a bit bored and lonely during this time. So thank you very much for your patience. Thank you for doing the right thing. And thank you to all of Canberra for supporting our children and young people as well. I have some good news today on our health workforce. So the number of Canberra Health Services staff who are not currently able to come to work due to being in isolation or quarantine is now less than 200. And at Calvary Public Hospital, Bruce, that number has fallen below 100. So we have overall across our public health and hospital system fewer than 300 people furloughed due to being in isolation or quarantine. So that is a significant reduction. The recruitment of new staff continues following the recent call out for extra staff, which led to more than 1,000 applications. So we've now brought 203 staff on board through this process, and the team anticipates hiring 191 additional nursing staff over the next few weeks to support the expanding COVID-19 vaccination rollout, which includes, of course, the opening of the AIS Arena COVID-19 mass vaccination clinic tomorrow. We're really grateful for the interest from the retired nurse community, student nurses and others who may have been in a non-frontline clinical role, and appreciate the flexibility in assisting with the ACT's COVID-19 response. The final thing I want to say before I hand back to the Chief Minister is a quick word about hospital visitor restrictions. Under the current public health directions, no visitors are permitted to enter health facilities in the ACT unless in exceptional circumstances, such as at the end of life or for birthing or paediatric care, and of course for carers of people who need that support in order to access a health service. I know that these restrictions are very difficult for patients and their families, carers and loved ones, but they are in place to ensure that we can protect the health of patients, of staff and their loved ones, and the safety of our health services overall. The Chief Health Officer and the Clinical Emergency Response Team regularly review the arrangements that are in place. But while there is a risk of community transmission, we do need to remain vigilant to protect our most vulnerable, particularly patients whose health is already compromised. Our fantastic health staff do know the importance of social connection and family support, and they will work with each patient to help them stay connected to their family and friends virtually via telephone and video conference. Oh, and that wasn't finally, sorry. Now finally, a reminder that the AIS Mass Vaccination Clinic will begin operation from 10 a.m. tomorrow. Appointments at the Garran Surge Centre have been relocated to the AIS, with the exception of bookings at the Access and Sensory Vaccination Clinic, which will remain at Garran for the time being. All other people with appointments at Garran have been contacted about the move and given alternative options should a straight swap not suit them. So announcements on the Access and Sensory Vaccination Clinic and the future use of the Garran Surge Centre will be made shortly. And with that, I'll hand back to the Chief Minister.
Thank you very much, Rachel, and we'll take questions. Rosie.
The Queensland Premier wants more research done on the impact that opening up her state at 70% double dose will have on children aged 12 and under. How concerned are you about leaving our young population vulnerable, given that they are unvaccinated?
Very, and I would welcome that further research being undertaken.
Will that be a condition of us reopening?
Well, we're a little way away from 70% double dose, and I've indicated previously that that is not the more of the two milestones that are so often talked about. 80% is considerably safer than 70. The national plan does not require opening up, but it would be an easing of restrictions as we pass through 70, but a more significant potential easing of restrictions as we pass through 80 nationally, by which point I hope the ACT will be 10 percentage points ahead. One of our challenges is we don't yet have an approved vaccine for under 12-year-olds. So the immediate priority is to vaccinate the remaining Canberrans 12 years and over the next 3 months. I don't know yet what vaccination options might be available for under 12s, but I need to better understand what the implications of a broad scale opening on that entirely unvaccinated population will be. I don't know yet, so that I'm not drawing any conclusions on that. I just want to know. I think it's useful to know. And once we know and we have some information, we can then base future decisions.
Victorian health authorities yesterday conceded that getting that state back to COVID-0 was now impossible. The ACT has continued to record low cases, but there are still cases active in the community. Could you see the Territory conceding that COVID-0 is out of reach, and would you look to peg reopening to vaccination targets of your own setting?
I don't think COVID-0 is out of reach in relation to this outbreak. Our effective reproduction rate, the latest data I've been given, has dropped to 0.8, so well below 1, which does mean that if we continue on this trajectory, then we would be able to contain this outbreak and get to a point that we have no infectious cases in the community. However, I readily acknowledge that we are still at extreme risk from New South Wales. And that's why in my opening remarks today I highlighted our priorities and how we would manage and how we will manage the next 3 months. We've got 3 tools in the toolkit to respond: vaccination, test, trace, isolate and quarantine, and the public health social measures. Now, vaccination is going to do most of the heavy lifting. TTIQ is partially effective, as we've seen again today. We've got half of our new cases tucked away safely in quarantine for their entire infectious period. I want to see that get higher, and we will still need some ongoing public health measures. The exact nature of them changes as the vaccination rate increases and if we can maintain effective TTIQ. And part of the key to maintaining effective TTIQ is to have low case numbers. If you just let it rip, you lose that weapon. And we can't rely solely on vaccination. Not in the next 3 months.
Just on the under 12s, Chief, you mentioned there's, research is possibly underway, but no vaccines available yet to that cohort. Even so, do you think the national plan should not just take into account teens, but under 12s too in vaccination thresholds?
I think we can only operate the national plan on the basis of those who are currently eligible for a vaccine. And so we have to strive towards those vaccination targets. The ACT is doing very well, but I do need to remind people to read the detail of the national plan and to understand that no one moves until the nation gets to 70% and 80%, and that at 70% it is a very gentle move. There's no Freedom Day at 70%, and it is really frustrating that reporting of this, which generally is just regurgitating what certain federal politicians are saying, suggests that 70% is Freedom Day. It's not. It can't be. It's not safe. But it is an important milestone to strive towards, and it does allow some relaxation in relation to the public health social measures, but only some and gently. 80% is safer than 70, and 90 is safer than 80. And if we could get to 100%, which we won't be able to, but if we could, as close as we can, and in the ACT we've got many cohorts who've got 95% plus first dose, our community is even safer. So it is a race between now and when the nation reaches 80%. Let's see what Canberra can do and see if we can get above 90 by that time.
Chief Minister, ACT seems to be a hostage to the fortunes of New South Wales. Are you concerned at the continuing emphasis that the Prime Minister, the Treasurer and the New South Wales Premier are putting on opening up, and the fact that this might be detracting from the public health messages that you obviously believe are so important over the next 3 months as we get our vaccination rates up?
It would be preferable if the language used was not opening up, but gradual easing of restrictions, because that is what the national plan actually says. And it would be even better if the acknowledgement was clearly that 80% is safer than 70. If both of those things were part of the narrative of the Prime Minister and the New South Wales Premier and Treasurer Frydenberg, that would be very helpful for the national debate and probably the nation's mental health as well.
On New South Wales, the Premier seems very committed to, I know you don't like these words, but to opening up that state once they hit 70%. What kind of risk does that pose to us as the island in the middle of New South Wales if they allow free travel, even within that state?
Sure, okay. Now look, obviously Premier Berejiklian will use the words that she wants to use. I don't interpret her words in quite the same way as opening up. What I have heard her say is that she would grant some additional freedoms, i.e. easing of some restrictions on fully vaccinated people once that state got to over 70%. So I think they're two different things. I think they're being conflated. Now, if I'm wrong and the Premier is genuinely talking about opening up the state at 70% and opening up in what I think is commonly understood to mean no restrictions, that would be very problematic. But I do not believe that is what New South Wales are intending. Now, of course, New South Wales can't do that under the national plan until the nation has reached 70%. So they would be breaking the national plan and breaking the commitment they've made to every other state and territory. We need the nation at 70% and a jurisdiction at 70% in order to be able to move through that next step. But 70% is a gentle step. 80% is a more significant step. But the best step to where we all want to be is when we have our vaccination rates even higher. And it's encouraging that New South Wales are doing so well in vaccinating their population. And to go to the second part of your question about the risk that New South Wales poses to the ACT, well, it's considerable, but it's reduced the more vaccinated they are. And so I'm really pleased to see the level of vaccination in New South Wales. That's a great thing. That helps protect Canberrans as well. But it's also on us, and it's in our hands about how vaccinated we are. So that's why we want to do better than New South Wales, and I think we can.
On business support grants, we understand that the criteria for businesses to receive those grants are that they can't be receiving similar grants from other jurisdictions, even if they're operating across jurisdictions and their income has fallen in the ACT. Is that fair? And do you think there is scope to provide more support for businesses which have seen a fall in revenue from the ACT side of their business?
In answer to the first question, look, I believe so, but it would depend a little bit on what sort of assistance they've been able to access in other jurisdictions. But I don't want double dipping. We've been very clear on the need for the ACT government to target our support to ACT businesses. In relation to whether there will be further support for business, yes, there will be. We've announced another round today in relation to commercial tenancy support and tax relief as long as landlords pass on a benefit to tenants. And beyond where we are now, and as we look over the next 3 months, there are going to be some industry sectors that just either will have restriction on their ability to operate to their maximum capacity, or they'll have no market because Sydney, New South Wales, Victoria will continue to be COVID hotspots until the vaccination rates are up to quite a level. So it's pretty clear to me that industries like tourism and hospitality will need ongoing support, but industries that can get back to work and operate wouldn't need that support in November and December. So there's going to be a narrower group of industry sectors who are going to need a long tail of support. That's understood, and we're talking with the Commonwealth about this. And this will be the case for the tourism industry in most states and territories. And so an integrated national response for that sector makes a lot of sense. But it's going to vary by industry sector. And as I outlined in my opening remarks, we'll do our best over the next 3 months, public health being the number one priority, but to get more activity in our economy and to bring more jobs back. And what I'm absolutely confident of is an incredibly strong rebound for the ACT economy once our population is very highly vaccinated and we can ease off on the public health measures. We'll have a really strong, what economists might call a V-shaped recovery. There's going to be a lot of activity. 2022 is going to be a great year for business in Canberra, and Christmas will be really busy in Canberra as well, provided we get ourselves vaccinated. And that's our task over the next 3 months.
COVID zero is no longer an achievable goal in New South Wales or Victoria. What is it about the way we've handled the outbreak here in the ACT that's managed for us to still see that as an achievable goal? Is it simply that we're a much smaller jurisdiction and we tend to be a jurisdiction that follows the rules, or is it something else?
Well, they're two very strong contributing factors. I think the analysis that's been done by government and by some in the media sourced off a variety of different measures, from the Google movement data to our own compliance activities, to what we observe in the behaviour of Canberrans, is that people take this seriously. They understand the risk, and Canberrans are very community-minded people, on average. Through this experience, this last 18 months, we've learned a lot about ourselves. We've learned a lot about what's important in life. We've learned a lot about how people respond to really challenging circumstances. And we have seen some amazing things done by individuals in our community to support each other. The incredible work of our health professionals. There was a fantastic story on ABC News last night. I thought it really did justice to the amazing work of our health professionals. And I take this opportunity to thank them all and acknowledge not just them, but everyone in a variety of different parts of government, of the community sector, the business sector, and average Canberrans who've stepped up to support their community. It makes you very proud to be a Canberran.
Chief Minister, a question about the national plan. There's been a lot of reporting and commentary about how Victoria and, not Victoria, sorry, Western Australia and Queensland in particular have walked away from the plan.
I wouldn't quite characterise it that way, but anyway.
There has
yes.
been.
Yeah. Commentary, yes. Whether it's accurate or is another matter.
Is the plan still a workable way forward for the whole of Australia, and do you still stick to the plan as
Look, I believe it is when you actually look at the detail of it. And I think the problem has been too much glossing over, too much sort of alpha male aggressive posturing about it, and that really hasn't helped. Because when you read the detail of it, it's a good plan. It reflects the different circumstances that different states and territories find themselves in. And I think my greatest frustration is just how distorted some of the coverage of it is. And I know that that doesn't originate entirely in the media, although some sections of the media don't help, but it is largely this regurgitation of oversimplified, shorthand, 7-second media grabs that come a lot from federal politicians, sadly, that doesn't reflect what is in the plan. And the states and territories didn't sign up to the plan easily. It's a good discussion, and a number of important protections were kept within it about what would happen at 70 and what would happen at 80 and what would happen beyond. And too many of those things are glossed over or overlooked, and that is really concerning. No other
Chief
questions?
Minister, how eager are you to make some time to have a picnic?
Well, look, yes, I think along with 430,000 Canberrans would all like this to be over and like to be in a position where life could return to normality. To the extent that a small picnic over the next few days will make a difference, I hope it does. An opportunity, particularly for people who haven't been able to gather with others for a little while now, to do so. But please do it safely. Please think about your vaccination status. Now, I am really, really concerned that we have someone in their 20s in intensive care on a ventilator, unvaccinated. So to people who are not fully vaccinated, we are doing all of this for you to buy you the time to get vaccinated. And I wish we had more vaccines now, but we don't. So the vaccine you can get today is the best vaccine. And please stay safe. Thank you. Questions for Dr. Johnston?
Doctor, the relatively low testing numbers, given lockdown and reduced contact, how much of that could just be down to we're not interacting, so there's fewer colds and hay fever and things like that, so people just don't have the symptoms?
Look, I think that's a factor because people are not interacting as much, they're not going to school as much or childcare. But we certainly in recent days have had a significant increase in our exposure locations. I mean, most of them are casual exposure locations, but still require people to get tested. So we definitely need to see those numbers over 3,000. So I just still encourage everyone with the mildest of symptoms to go and get tested. And even if you're asymptomatic but you've been identified as a casual close contact, of course, you need to follow the public health advice and get tested.
We're yet to see really rapid increase in our case numbers. We're now 3 weeks in. Have we managed to keep a lid on this outbreak?
Yeah, I mean, it is pleasing. We've had blips, we've had days where we've seen higher case numbers than others, but the rolling mean is steadily going down, so that's great. And I think, that, as the Chief Minister said, the latest national doherty modelling has just come in to say that our transmission potential is below 1, the effective reproduction number is below 1, and so because of those tough social restrictions, which are, really challenging for people to abide by, but that's why we're not seeing rapid escalating numbers. If we were out and about as we normally are, given our current levels of vaccination, those numbers would be skyrocketing.
Each day there's a number of people who are identified as close household contacts of existing cases and a number of people who have then been infectious in the community. Is that because people aren't following the rules and staying at home when they are household contacts, or is that because Delta is just moving very, very quickly?
Yeah, there's a number of factors that contribute to people being out and about and infectious in the community, and overwhelmingly that is because people are unknowingly infectious in community. And that goes a little bit to our issue with unlinked cases and the mystery cases. And so their time in community is relatively low risk because we've been in lockdown, so they've been going to Woolies to do a shop and they've had a mask on. So, but we because they actually have been out of the house, we still count that. There are a few people that are struggling to abide by quarantine. It's tough. It's really tough. And for some of the more vulnerable cases in our cohort, we're working really closely with them to assist them to do that.
We heard recently about a case in Sydney where somebody overdosed on horse medicine, ivermectin. Do you know whether there's been any presentations of people to ACT hospitals trying to self-treat with dangerous substances?
I mean, that'd be a question for Canberra Health Services, but I'm not aware of that.
Question about Delta and the young. Is it affecting the young more because they're an unvaccinated cohort, or is the nature of the variant at play? And just how dangerous is it for young people in the light of having a man in his 20s, I take it, a fit young man in his 20s, now on a ventilator?
Yeah, certainly across the globe, we're seeing more people in the younger age groups and the under 18, so children being infected with COVID-19. And part of that is a factor of it being more infectious, so it's going through households. So if there's an introduction from an adult or a sibling, such as we've seen in the Lyneham High School cluster, then other siblings are likely to become infected. And part of that is due to the fact that the vaccination rates are just not there yet in the sort of middle-aged cohort where we need them to be, but also, going right down to the 12 plus. In terms of severity, I think the evidence is really still out on that. It's absolutely true that the rate of severe infections in very young people is very low compared to older people. So it's different from influenza in that way. But when you see increased numbers, absolute numbers in children, you will start to see serious presentations. So that's the nature of the numbers. So I hope that answers your question, but I think the evidence is still evolving. It's a factor of increased transmissibility of the virus, reduced vaccination by and large.
There's an increased, growing body of evidence from Europe looking at mixing vaccine types for first and second doses. Would you look at that in the ACT, given there is an abundance of AstraZeneca at the moment and there is delays to Pfizer suppliers? Is that being considered as part of the ACT rollout?
So the ACT, like other jurisdictions, is guided by the national ATAGI body, who makes recommendations on vaccine scheduling, prioritisation and utilisation. They are certainly keeping up to date with the latest international evidence. They meet with their international colleagues from counterpart agencies through the night, every night. And so they're keeping abreast of that. I think some of that evidence of mixed vaccine scheduling is, again, very early in terms of what it buys you in terms of additional benefit in immunity. What ATAGI has come out and said is that if you have had a serious adverse event following your first dose of either an mRNA vaccine like Pfizer or AstraZeneca, then you shouldn't receive that same dose the second time round. So there are specific indications for when people would receive a mixed dose now. But in terms of broad-scale recommendations, that evidence is not in yet for ATAGI to make those recommendations.
The Chief Minister provided some commentary about the need for more research on the impact on children aged 0 to 12 if we do open up, but ease restrictions slightly at that 70% mark. As a health expert, a medical expert, what are your concerns for those vulnerable people in that age cohort?
Yeah, well, we certainly know for people that have pre-existing vulnerabilities, so immunosuppressed for a range of reasons, for example, they are across the board going to be more at a higher risk of severe complications. So, of course, there are ongoing concerns and some risk mitigation measures that will continue to be wrapped around those individuals, I would see, for the future, until some of these international trials are in around vaccination in the under 12 cohort. I think, though, in the main, children are still considered less likely to acquire the virus, less likely to transmit the virus, and less likely to get severely unwell. So while we don't have a vaccine that is registered for that under 12-year age group, it's beholden on everyone else to get vaccinated to protect them as much as possible.
I know you have to go. I've just got one more question. The Deputy Premier in New South Wales identified 2 more cases in Queanbeyan and says they're linked to Canberra. Can you provide any clarity on where they are linked to?
So those notifications have just been provided to us from Southern Local Public Health Unit this morning, and so we're just undergoing our investigations at this stage. Hopefully I can give you more clarity tomorrow.
Just a question for the Health Minister, if that's okay. Minister, just in regard to the drive-through clinic in Fyshwick that was open today, how supportive is the government of private businesses setting up their own clinics, and would the government have looked to establish a drive-through option if the one in Fyshwick didn't happen?
We haven't actually looked at establishing a drive-through option. We're opening the AIS mass vaccination clinic tomorrow, and that's going to enable us to have well over 20,000 appointments a week when we get the supply of Pfizer. The way the whole program has worked between the Commonwealth through primary care and the states and territories is we have really been focused on providing Pfizer vaccinations. And while we have a small AstraZeneca clinic, the AstraZeneca has really been provided through general practice and now through pharmacy as well. And of course now some general practice is doing Pfizer. So it's good to see that businesses and private health organisations are taking up every opportunity to get their workforce vaccinated, to encourage vaccination across the community, using that AstraZeneca supply that we know is plentiful. But we haven't considered doing that model because we don't think we need to, given that we've got the mass vaccination opportunities that we do with our Pfizer supply.
Minister, can you provide any update on vaccination rates for our healthcare workforce?
Yes, so at the moment our estimates around vaccination rates for our healthcare workforce are based on a self-reported survey data. So for for staff directly employed across all healthcare facilities, that data is indicating that over 60% of healthcare workers in the ACT have self-reported that they are partially or fully vaccinated. But our Clinical Health Emergency Coordination Centre is confident that actually that number is significantly higher than that. So we're still working to get that further information. What I can also indicate is that we know that across many areas of Canberra Health Services, for example, those numbers are significantly higher. So for our testing teams, for a couple of large divisions within Canberra Health Services, those numbers are up around 80%. And just to provide some sort of reassurance for people around those who are working in high-risk areas, so who may be working in COVID wards and the like, anyone who is working in those high-risk areas is either fully vaccinated or they have had a one-on-one specific conversation with their supervisor about the risk of working in that environment if they are not fully vaccinated. So those environments are being managed very carefully in terms of those vaccinations as well.
And given those relatively high vaccination rates among healthcare workers, are you confident that there will be no need to make them mandatory?
Look, I think when we look at the 60% self-reported figure across all of our health facilities, that is not where we would want it to be. That's in fact lower than the adult population for the ACT for first dose. I think our second dose, our fully vaccinated, is significantly higher than the general population. But that is not where we want it to be. We absolutely want it to be higher. We're confident the number is higher, but we want it to be at or close to 100%. There will always be some people who, for individual reasons, are not able to be vaccinated. So that question about mandatory vaccination across the health workforce, across the disability support workforce, in addition to the aged care workforce, is a very live conversation across state and territory health ministers, as well as potentially going to the National Cabinet conversations as well. And what we have seen in aged care is once it became clear that this was going to be mandatory, we've seen our vaccination rates in that aged care workforce, who were prioritised from day one, almost double to around 87%, and that will be mandatory by the 17th of September, on the 17th of September, to have at least one dose of vaccination. So that is a live conversation, and what I can tell you is that certainly from the CEO of Canberra, the interim CEO of Canberra Health Services, there is regular messaging out to staff around the importance of getting vaccinated, around how to do that, and providing that priority vaccination phone line, and people are booked in very, very quickly if they haven't already received a vaccination to ensure that they can get access to that.
Given that live conversation, then when do you think we just have to make a call on it?
Yeah, look, I think obviously some jurisdictions have already gone ahead and made a call on that. So New South Wales has done that. Health ministers will talk about it collectively, but we'll also consider it within our individual jurisdictions. And it's a conversation that I've already had with the Chief Health Officer and will continue to have as well with the Chief Health Officer, with the Cabinet, with the CEOs of our health services across the board as well, to get their views. And of course, with our unions and staff representatives to ensure that we're bringing in on board staff views about this as well. But obviously, AMA already advocating for this to be the case.
Thanks, everyone.
Thank you.
Yeah.